Well, while some people might think that a nose job, breast implants, or any other form of plastic surgery is the key to their happiness, plastic surgeon and author of Building Foundations for a Change says that it's not always true.
That's right. Dr. Stephen Davis is here to discuss the negative side of plastic surgery and why plastic surgery might not be the best choice for everyone. And I got to say, I'm just surprised that a plastic surgeon would be the one saying plastic surgery might not be the right thing.
It's true. You know, one of the most important things about going to see a plastic surgeon is trying to get a good feeling about what you're coming to do. And a lot of times people approach this from the wrong angle. They may be coming to the table to talk to the plastic surgeon about things that bother them, but it's also at a wrong time in their life, and it may not be the best time to really have surgery.
What's the number one reason that you would turn someone away and say, I don't think now's a good time or a good procedure for you?
The first one would naturally be a medical reason. So someone that's really not medically suited for any kind of elective surgery, you would definitely tell them to go away. But the second one, which is a very close second, is that they're just not mentally in the game, if you will, to really have that kind of a procedure because of things that may be happening in their lives socially, or they may be going through a divorce, or something that just makes it so that they're really not going to approach this in the right mental frame of mind that they should.
Teresa's here.
Yeah.
And Teresa, you had an interesting experience with Teresa, who's been on both sides of the equation with plastic surgery.
Right, correct. There's Teresa, and she's wonderful. She'll be able to explain a lot of this stuff to you. One of the first parts of this was when we kind of met, it had been almost, I guess, 20 years.
Yes, 20 years exactly.
From the first procedure.
You had was it a breast reduction?
Well,
originally, or?
Well, originally I was diagnosed with breast cancer. They weren't sure, but they were trying to rule it out. I had developed a cyst in my right breast that was large, and it was a really bad time in my life. It was a chaotic time. I was going through a divorce and a change of career that wasn't prompted by me, and all those things were happening when all of a sudden a typical GYN exam, yearly exam, came up with that result. So immediately I had that taken care of. Sent me to a surgeon. He removed it, and that was taken care of.
Okay.
But then there was a problem.
What was the problem? The problem How did the two of you meet, in other words?
Well, the problem was that when the bandages came off and I looked at myself in the mirror, I broke down. I couldn't believe that now that I was going to be in the dating world again, and I would have two different breasts. I was asymmetrical, I looked hideous, and who would want me? So in haste, I ran to a plastic surgeon, didn't care, didn't worry about other options, and just said, just reduce the other side, just do something about that.
Make me this match, make me feel better, but yeah.
Right, exactly.
And that really wasn't the right thing to do for me, because I've been well endowed all my life, and now at 37, here I am, and I'm looking down, and all I see are my feet, and that was hard.
What would be your number one piece of advice for somebody considering plastic surgery to think about before they come to your office?
I think the first thing would be make sure that you really have an understanding about who you really want to turn out to be after this procedure, and make sure when you're having your consultation with the plastic surgeon, you get along very well and you have a
good relationship and rapport.
Exactly.
All right.
Good to have you both here.
You can read more about the negative side of plastic surgery. Pick up a copy of Building Foundations for Change.